Hi, I'm Melissa. I'm an oncologist. It's not something I always bring up in initial conversations when I meet people because it does tend to take people a moment to think about that and take a pause. And I just think that's because of the seriousnness of cancer, and everybody in life is touched by that disease, whether it's personally or through a family member or a loved one. Well, my mom had breast cancer when I was growing up. I was 12 when she had her first cancer, and she had another cancer 2 years later, and I saw her go through the treatment. So I know that had an impact, even though I didn't realize it when I was 12, that is what would eventually lead me into oncology. It definitely played a huge part of it when I got into my older years and realized I wanted to do something that would make a difference. So one of the big reasons that I went into it, based on my mom's experience, was in her day and age, cancer was kept private. So people didn't talk about it, and also it was really focused on how do you treat the cancer. There was really no talk on what do you do after the cancer's been treated? How do you get over the side effects of treatment? The patients who show up there aren't there necessarily to talk about their difficult journey for that entire hour, but they're there to actually talk about what's making them feel better. So there's that emotional aspect. As far as the physical aspect, one specific example that I can think of, and this harkens back to this patient that I told you about, a side effect of chemotherapy is nerve damage. And we know that exercise increases blood flow to our nerve endings, and blood flow provides oxygen to the nerves, and you're less likely to suffer this particular side effect of nerve damage if you're exercising. So Jen has a specific expertise and training in how to make sure that patients can minimize that particular side effect. That's just one example of many, but I could go on and on. I came to know Jen through a patient, and I think that's really key here. It's really the way that a doctor will want to see that a patient succeeds. It was a firsthand experience, and the patient, my first patient that ever worked with Jen, did so incredibly well. I just had never seen anything like it. And I think that's really a hit-home message. And I'm just so indebted to what she has done for the community of people who have cancer, not just in Davis, but now that she has this via the internet to bring to the home. Jen is one of the only people I know that has that expertise. I would recommend Cancer Champions without reservation. I can't tell you what a world of difference it's made in my own care of patients. The resources at Cancer Champion provide the detail that patients need, the inspiration patients need, the instructions patients need to know exactly what to follow to get them these results that we're all after, which is feeling good and beating cancer.